Our patient for this assessment is Jane. She is a 14-year-old female who's recently been referred for weight management counseling. Jane has recently or has had a yearly weight gain of 10 to 15 pounds per year over the past 6 years and has recently progressed into the obese BMI category for her age. Jane currently has no medical diagnoses but does have some risk factors, which we'll go over later. Currently, Jane is 62 inches and 152.9 pounds. In order to calculate her BMI, we would take her weight in pounds, divide it by her height in inches, and then divide it again by her height in inches and multiply by 703. Taking these numbers, she does have a BMI of 27.9, which places her in the 96th percentile for girls aged 14 and categorizes her as obese. Jane's stature for her age is in the 35th percentile, and her weight for age is in the 95th percentile. For family history, Jane's mother, who is age 41, is obese and does have hyperlipidemia. Her father is age 45, is also obese and has type 2 diabetes mellitus. She has a sister age 8 and brother age 4. Both have no known medical disorders at this time. Some possible health complications just for obesity in childhood: hypertension, dyslipidemia, insulin resistance, type 2 diabetes, sleep apnea, orthopedic and joint problems, body image disorders, and low self-esteem. Hyperlipidemia is a high concentration of fats or lipids in the blood. It is a major risk factor for the development of heart disease later in life. Jane does have an increased risk of this simply because of her mother's history. And then type 2 diabetes, which is a metabolic disorder characterized by high blood sugar, insulin resistance, and lack of insulin. Jane also has an increased risk of this because of her father's history. The lab results from Jane's pediatrician show that she is currently within range for her sodium and potassium intake. Her cholesterol and her triglycerides are also within a normal range. Her fasting glucose was high at 116. Her HDL is low, and her LDL is borderline. So some areas of concern: even though Jane's cholesterol and triglycerides are within normal range, she does have low levels of HDL and borderline levels of LDL. This can indicate that Jane might be beginning to develop dyslipidemia, which is a precursor to hypertension and heart disease later in life. Jane's fasting glucose levels were also elevated, indicating that she may be developing some insulin resistance, which is a precursor for the development of type 2 diabetes. Again, she does have an increased risk of this because of her father's history, just as she has a increased risk of hyperlipidemia, which is basically high cholesterol, because of her mother's history. Her nutrient needs, based on all of her information, she would need 2,368 calories per day. Macronutrients, her carbohydrates would be 266 to 385 grams per day. That is a range of 45 to 65% of her daily calories. For fats, it's 66 to 92 grams per day, which is 25 to 35% of her macronutrients, and then protein, 59 to 177 grams per day, which is 10 to 30% of her macronutrients per day. There are quite a few micronutrients that everybody should be meeting, but the most important ones, just because of Jane's age and her growth: calcium, 1,300 milligrams per day; iron, 15 milligrams per day; vitamin D, 600 international units per day; and folate, which is 400 milligrams per day. Based on Jane's 3-day food diary, she's consistently consuming an excess of calories each day. For the 3 days that she did provide, she did give us she did meet for all of her macronutrient levels in excess. She's currently not meeting intake for some micronutrients that include iron, vitamin D, vitamin E, magnesium, or potassium. All of these are concerning because they are essential for her growth and development. She is more consistent with her intake for calcium and folate, so she met those for 2 out of the 3 days for her intake. And then her sodium intake is consistently above the recommended daily intake. as she is at 300% of her daily intake per day. Now, based off of her blood work, her potassium levels were okay, so she might be getting enough, or she may have enough stores, but it is something we want to pay attention to. And then her sodium intake, she was within range, but if she consistently continues to eat or in excess of 300% of her recommended daily intake, that might not last for long, and she may eventually have an increased amount of sodium in her blood. Some recommendations for Jane. I would first refer Jane and her parents to some nutrition education classes. Obesity seems to be a little bit of an issue within the family due to her family's history, her parents. So possibly referring them to nutrition education classes would not just benefit Jane, it would benefit her parents as well as Jane's siblings for the future. And then I would also assist Jane's parents with applications for governmental assistance programs such as the Supplemental Nutrition Assistance Program. They did indicate that they often run out of money towards the end of the month for food, so they are consistently going out for fast food towards the end of every month, which is probably part of the problem with their weight management. So just getting them some additional assistance to make sure that they have enough money to get the food that they need throughout the month. And then specific recommendations for Jane, just increase some daily physical activity level, just so that, finding something that she enjoys so that she's more consistent or more likely to comply with those recommendations. It could be anything from jumping rope, going to the park with her siblings, or anything like that, just to get her a little bit more active throughout the day. I would also refer her to some cooking classes. This would help to teach her some lifelong skills and get her to, become more involved with the family. Going along that line, she can also assist with the weekly grocery shopping and daily preparation of family meals. Getting Jane involved would most likely have the best benefit and most positive outcome for her, simply because she would feel more in control of the situation. She'd be able to choose certain things that she likes, and just getting more involved in general will help make her a little bit more excited about trying to live a healthier and more nutritious lifestyle. Healthy weight for Jane based on her age and her height is 127 pounds. That means she would have to lose close to 25 pounds, or actually I think just about 25 pounds, which can be a little bit overwhelming if you just look at the number as a whole. So I would actually just recommend that she lose around 5 pounds per month, or about a pound and a quarter per week. That's a little bit more manageable and a little bit less daunting of a task. It also allows us to make sure that Jane is losing that weight slowly so that it has no impact on her growth, because she is still young. We still want her to grow and to have all the nutrients that she needs to be able to do so. Some programs that would be beneficial for Jane. First is Girls on the Run. It's actually a nonprofit organization that has a little bit of a nutritional component. It's actually designed to help young girls become more intentional in their decision making. It helps them to embrace their differences while integrating running, games, and just empowering them through a sense of teamwork. So it's not necessarily something that is nutrition based, but it would help to increase Jane's physical activity level and help her learn to make some positive decisions, which ultimately will assist Jane in meeting all of her goals. Another program is Camp Jumpstart. This is actually a summer camp. It does help children between the ages of 9 and 18 to achieve weight loss goals. So this is a little bit more of an intensive program. It teaches lifelong skills for positive decision-making, emotional development, and social skills, and utilizes a whole health and nutritional education program that drives lifelong success for each of its campers. And then there's Kids Fit at Robert Wood Johnson University Hospital. This is actually a program designed for parents and children. It emphasizes the development of healthy lifestyle changes using exercise, nutrition, and behavior changes. It's run by a registered dietitian, licensed professional counselor, and exercise physiologist. As of right now, there are no reports of any lowered self-esteem or body image issues, but those could happen later in life. So something like this with a licensed professional counselor would help to identify any possible issues in that area and address them early for Jane, as well as just the fact that the program is designed for both parents and children would help the entire family, because the positive changes that Jane and her parents make will actually also impact Jane's younger siblings and help them to develop a healthy lifestyle and prevent them from becoming or having any issues with weight in the future. Just the meal plan that I created for Jane. So for breakfast, for that first day, it's 1 cup of non-fat plain Greek yogurt, a cup of muesli or quarter cup of muesli, and a quarter cup of blueberries. 2 cups or so for lunch is a salad, 2 cups of mixed greens with cucumber, tomatoes, chickpeas, and walnuts, and then a tablespoon of mixed balsamic vinegar and olive oil. For dinner, skinless chicken drumstick, 3/4 of a cup of fennel, and half a cup of brown rice. And for snacks, half a cup of raspberries, a medium bell pepper in the afternoon, cut into strips with some hummus to dip into. For beverage, I tried to keep it consistent throughout each day. So cutting out soda entirely would probably be a little overwhelming and not necessarily something that Jane is agreeable to. So I would try to make sure that she was switching herself over to diet soda for the time being and taking that as no more than 1 of those per day, and just so to slowly wean her off of any of that. For coffee, that's no problem for her to continue to have. I reduced the amount of half and half that she put into that to 1 tablespoon and then half a tablespoon of sugar. She could have juice or apple juice or orange juice for her breakfast, but throughout the rest of the day, she should just be drinking water to making sure that she's hydrated and getting enough of that. And like I said, I kept that pretty consistent throughout each of the days. For day 2, it's actually just some toast with peanut butter and a medium banana in the morning. For lunch, a sandwich with sprouted grain bread, avocado, some hummus, and then vegetables, and then a plum for just as an additional part of that. And then dinner is chicken breast cooked in olive oil, some quinoa with olive oil and lemon juice, seasoned with salt and pepper, and then some asparagus. Snacks, we have plums and clementines. And then, like I said, beverages, again, the same as the previous day. And then for the third day, for breakfast, 2 large eggs scrambled with some peppers and onions, cooked in some olive oil, and then topped in feta cheese. For lunch, we got a little bit more creative. We put some spaghetti squash topped with some spaghetti sauce and meatballs. For dinner, some salmon roasted in some olive oil with Brussels sprouts that are topped with walnuts and some brown rice. Snacks, again, plums. In the afternoon, an apple with some dry roasted almonds. So throughout each of the days with her meal plan, I tried to make sure that she was meeting each of her My Plate recommendations for fruits and vegetables, for some protein and some grains, as well as dairy. So that's why you see some of that, the cheeses and the yogurts. Well, there's a lot of vegetables and just small amounts of protein to make sure that she's meeting that goal.